As a physician, I think all of us have people that we remember. And when I think about a particularly memorable case, it's a young lady who was at work when she was standing nearby an industrial roller and her ponytail got caught into this machine. And unfortunately, what resulted from that was that the roller pulled off not just her hair, but also the entire scalp. She had loss of the entire eyebrow, her forehead, her scalp. She lost part of her ear on the left side, and that extended all the way to the back of her scalp. This was a severe injury, one of the most severe I've seen. It's one of those cases that, as a plastic surgeon, you might see once in your lifetime. The doctor on call for facial trauma felt like this was not the typical facial trauma, as you might imagine, as we typically deal with broken bones and broken jaws and things like that, and this was far and away above that. And so that doctor called me because he knew that I was on call for kind of general plastic surgery things and asked if I wouldn't mind taking care of something like this. I immediately knew that I was not going to be able to do the surgery myself alone, but I needed the help of one of our microsurgery experts. One of my close colleagues is Dr. Daniel Kwan, who is our chief of microsurgery in the Department of Plastic Surgery. He rushed into the hospital to help with this case. We took the patient immediately to the operating room. I thought the emergency room did a fantastic job of expediting this kind of injury, which is exactly why Rhode Island Hospital is a level 1 trauma center. We saw the patient in the operating room, and immediately we got to work to salvage this lady's scalp. She was in the operating room having surgery within an hour of presentation. After about 6 to 8 hours of complex surgery where we had to utilize a microscope to find individual veins and arteries that we could sew back using sutures that are thinner than the size of a human hair. We were successful in terms of replanting the entire scalp. Afterwards, the young lady had an immediate benefit. We could clearly see that the skin was healthy. She stayed in the hospital for a few days, and given how amazing she did, she was discharged soon thereafter. It did take her a few more surgeries, though, to get her back to kind of full recovery. We were able to do some minor kind of scar revision type of procedures to get rid of some of that bad skin. The good news after all of it is that the patient is living a normal life. She's back to her family. She's back to her kids. She can go out in public and be treated like a normal individual. It really highlights the expertise and the dedication of our team that we were able to come together to provide a result that is as good as any in the world today. I'm proud to work in a hospital where our nurses, our technicians, our staff, and certainly our doctors all come together, especially when we see a horrific injury like this, to do everything we can for the benefit of the patient. I mean, this is why many of us went into medicine, and this is also, as I said, a case that I will remember even 30 years from now as I look back on my career.